I'm Dr. John Delzell. I'm Vice President of Medical Education and the Incident Commander for COVID response at Northeast Georgia Health System. You've heard from our speakers here today about the number and the severity of cases that we're seeing and the high percentages of those patients who are unvaccinated. You've also heard that we're seeing younger patients who are sicker than ever before. And you've heard how this is impacting our healthcare workers, who were frankly already exhausted from fighting this pandemic. They're now facing a surge that's predicted to be worse than anything that we've seen before. Unfortunately, many more people in Georgia will get sick. And if you do, there are some things that you can do. If you've been exposed and you're having symptoms, we want people to quarantine. We want them to get tested when they can. We want them to follow the protocols of their employers and their schools and the places that they are involved with so that they will know what to do. They need to get care for things that need care for. One of the things that we've seen across the pandemic is that people delay care because they're scared or they're worried. The emergency rooms are full, but as you've heard, a lot of the illnesses like heart attacks, strokes, diabetes, those things haven't gone away just because of the pandemic. People still need to get in to get their care for those. If you're having symptoms, we want you to go to the doctor. We want you to go to the hospital. But remember, there are other things that we can do before we get sick to prevent and decrease the risk of COVID. You've heard it here, every one of us has said it. It's the 3 W's. Wear a mask, wash your hands, watch your distance. I think one of the things I would encourage you is if you can, avoid large gatherings. Don't go to places where there's a lot of people there. You know just by the percentages that there will be people there who are unvaccinated. There will be people there who are asymptomatic carriers of COVID, and your exposure to that is high. And finally, I'm just going to add my voice and that of Northeast Georgia Health System to the pleas of all of us here today. Go out and get vaccinated. If you haven't already been vaccinated, this is the time to do it. This vaccine's a new weapon against COVID since the last surge. The data and the research of millions and tens of millions of people who have gotten the vaccine says that it is safe for people to take. There aren't a lot of side effects. The risk is very minimal, and the upside benefit is enormous. The vaccine's available for anyone down to the age of 12, for all races and ethnicities, and what we've seen is lower levels of vaccination in younger people, and that's really contributing to those folks having a higher risk of getting COVID. The vaccine's free and it's easy to get, but if you wait until you get into the hospital and you have symptoms, it's been too late. We know that all of our health systems have the vaccine available. It's available at hundreds of pharmacies, the health departments, grocery stores, doctors' offices all across Georgia. If you aren't concerned about getting the vaccine to protect yourself, do it for the people around you. Do it for the people you love. Do it for your healthcare workers that are taking care of you. Do it for your communities. You can do this, and it will make a difference.